So in Seattle, a lot of patients come in, they say, I want a natural look. I don't want to look overdone, but I want it to be worth my while. So how do we find that balance? It's kind of like the Goldilocks principle, how do you get it just right? So I think there are a couple of things to keep in mind. One is communication. A lot of times the patient will have a different idea of what looks natural than the plastic surgeon might, so really be clear on expectations. Another one is just to think in 3 dimensions. And facelifts are a really good example of that. A good facelift involves restoring volume. It involves a little bit of skin lifting, but not a lot of pulling. And it involves something to restore the health of the skin, because the reason you needed a facelift in the first place is because of the aging and sun damage and all those sorts of things. So you can reshape the face, but you also need to think about restoring the skin. So the 3D aspect of it might involve fat grafting. A lot of times people will try to really push the limits of what you can do with volume instead of a facelift. And I think that's one area where you can kind of get too far off in the wrong direction and paradoxically end up looking overdone without even having surgery. So sometimes really taking a comprehensive approach, getting a well-done facelift is actually better in terms of a natural result than doing non-invasive things where you really might have the same goal in mind.